Hey everyone, welcome to my live. I'm back with something super awesome today. Let's wait for a few people to join. Where has she put it?
Instagram live I happen to buy with Dr. Shastakadi in the house.
Hi everyone. Hi Monisha. Hi Puneet. How you doing?
Sonam in the house. Okay, ready.
I think so. We're going live today with Dr. Shaista Kazi. We've done one session with her before, and the response was fab. People really benefited from it. So today we're doing a second session with her, and the session is on moms, skincare for moms. As we usually tend to ignore ourselves, taking care of our husbands, taking care of the babies, we always ignore ourselves. So that is why today we're here to talk only about moms, skincare for moms, for ladies in their 30s. It's the weekend. What plans you all have, guys? It's Saturday night. Let me just add Dr. Shaista Kazi. We have a lot of questions from our live today. Anyone else has any questions? Please put it in our comments and we shall answer for you. Hi, how are you? Welcome back.
Hi, thank you so much for having me again.
My pleasure.
You know, we've done so many lives, both of us, after this, but
Yeah,
with you again, it feels like coming back home.
yeah, that's so sweet of you. So
Many people
yes,
must be seeing, that all of us doctors are just recycling around. But the thing is that because the quarantine is on, we are working 30% of what we used to.
yeah,
Most of
we
us are
have.
doing teleconsults. We're only going out for emergency cases. So we want to help whoever we can still in whatever way we possibly can. So that's the reason you're seeing so much of us.
But that's so great that you doctors are giving us free consultations online, helping people out in this time. So that's really nice of you, doctors.
Yeah, we
So
enjoying the journey as well with you all.
that's great. So yes, as I said, guys, today we have a live with Dr. Shaista, followed by a quiz. So we're going to have a quiz at the end of the session, and whatever Dr. Shaista has spoken about, we're going to ask questions related to that. Whoever answers them first, answers them right, gets a voucher or a cleanup or maybe some session with Dr. Shaista Kazi. Isn't that amazing? I'm super excited. I've told all my friends to come live for that. Like more than listening to you, they're more excited to win prizes.
We'll be happy to have them over at our clinic.
That's amazing. So let's start with the main topic for today: moms and their skincare.
Okay, so
Can you
today
tell us about the
basically,
five?
yeah, go on.
Sorry, go ahead.
No, please.
So, can you tell us about the five signs commonly seen once we reach the 30s?
Okay, so like Prisha said, it's all about skincare for moms. But even those of y'all who are not yet mothers but are already in your 30s, this will help everyone because 30 is a number where lots of things in our skin change. So, what we need to understand now, why is skincare in your 30s so important? Now, just
Yeah.
let's fast forward 20 years. Maybe we're 50 or 55 in another 20 years. And that time, there can be three scenarios. One, that when you go out, you hide your age. You're a little conscious. You don't want anyone to know how old you are.
Right.
Second, you tell them your age. Maybe you even add a year or two, and you are like, yeah, I look old because now I'm not so young. And you have that attitude. And the third thing is you just tell someone your age, and they're like, oh my God, really? But you look so
Yeah.
young.
You look
And
so
who
young.
doesn't like that? Who doesn't like to hear that? Everybody does. So we want to make sure right now that 20 years later, you are in the third case scenario. We don't need to hide our age because we should be proud of our age. We've achieved so much. Our
Right.
kids, our careers, even our marriages, our own personalities, we've built on it. So there's no need to cut out those years, but they shouldn't show on our face or our body. So we need to look after ourselves right now for that. So few things, like we'll start with saying some of the signs which start appearing in our 30s. One
Okay.
thing which lots of my patients have come to me with first is dull skin. So they're like, doc, I used to glow all the time. My face used to look so bright. Now there's no sheen. I'm looking very dull. That's very common in your 30s. What happens is, if you all have, like we did a talk on baby skin, and that time a lot of people were saying, I have a daughter, she has a mark, will the mark go? So I told them, don't worry at all, the mark will go. That's because at that age, the cell turnover rate or the epidermal turnover rate is so high that new cells are constantly being produced and
Right.
also being shed. So because of this, what happens is that there's nothing going to be left behind, no marks, no telltale signs. Once we hit our 30s, this goes down. It increases drastically all of a sudden.
Okay.
So all the old cells start collecting at the top of the epidermis, top layer of the skin. As a result of this, the reflection of light on our skin changes. And what
Right.
used to first shine off our skin and make us glow, now it starts giving a little dull,
That.
shadowy look. And we don't
Yeah.
understand what's happened suddenly because we are doing what we were doing or what we weren't doing. But that's
Yeah.
where we are a bit wrong. We need to now do something extra to artificially increase the cell turnover rate so that we can get the same glow that we had before. The
Okay.
second sign, we'll talk about this more in detail later. I'll just mention all the signs. So
Right.
the second sign is the fine lines and the wrinkles. Now this again depends. The fairer you are, the easier and faster these lines and wrinkles start showing. If you have a darker complexion, because we are a colored race, so we've got all colors in even India. If you go from north to south, we see all shades. If you're fairer, the fine lines and wrinkles appear faster. If you're slimmer or if you lose weight suddenly, after pregnancy, you go into these diets, workouts, you lose weight. What it leaves you with is sometimes a double chin because that's resistant, it doesn't go, and also fine lines and wrinkles around your eyes. And it's very difficult to, make them go away once they set in. When they're
Right.
dynamic, like, if they come only when you move your face, they're still easier to treat. But once these lines become static, then you need much more expensive and detailed treatment to get rid of them. And then that's just a correction. It's not a prevention anymore. So 30s is a good time to treat these because they have not yet set in. So we can, remove them before they become permanent.
Okay.
The third thing is pigmentation.
Right.
Now,
Yeah.
this is more common in the darker skin. Also seen freckles and all you see in the fairer skins. But in the darker skins, it's more difficult to treat as well. So there's melasma, you'll see a butterfly type pigmentation coming either on the cheeks, sometimes in the mandibular areas, or just freckles, just dark spots, lentigines, all that starts coming in your 30s. Now, this requires treatment too because sometimes it comes during your pregnancy and it fades off. But if you're postpartum, you finished 1 year, 1.5 years, and you feel it's not going, seek treatment fast before it moves from the epidermis to the lower layers into the dermis because dermal pigmentation is much tougher to treat.
Okay.
I'd like to say one thing here. In one of my previous talks, somebody had said I'm using scientific terms. So if anybody is not understanding anything or feels I should make it simplify it a bit, please put in a message. So I will, you know, re-explain that.
Yeah.
Okay. So this was about the pigmentation, which is one of the troublesome signs of aging, which we first start experiencing post-pregnancy or once we hit our 30s. The other thing what we see is, now this can happen maybe towards the later part of our 30s. Indian, how do Indians age? What do you see first? The middle part of the face starts sagging. It's called as mid-face ptosis. You start getting deeper. The nasolabials, which were not there earlier, start deepening. This cheek starts falling. You get jowls here, which are very annoying and they're very difficult to treat once they set in. And even your eyes, you start feeling a little baggy, as if the eyebrows, the entire mid-face looks like it's losing its you know, going into the direction of gravity. It's falling down. So
Yeah.
this also happens when you lose a lot of weight. Then it's much quicker. So, and nowadays everybody wants to be fitter. They want to lose the pregnancy weight very quickly. So they
Faster.
go into
Yeah.
these diets. Yeah, keto diets are on, whatnot is on, GM diets, 7 days. So in all this, what you get left back with is your weight is gone, but your face starts sagging. Even
Right.
if you feel that this is just about starting, you should seek treatment at that time. There are many levels of treatment, so you don't need something extreme if you start early. You
Okay.
can even use anti-aging and skin tightening treatments as preventives. You don't need to just, do it once you start noticing the sagging. It can even start beforehand as a preventive. And the
Okay.
last point that I would like to mention, the fifth thing, is this is not very common in everyone, but those who do get it, they are very harassed because they feel they've crossed their adolescence, they've passed their teenage years. So, why now? So, adult acne and facial hair. So, basically, it's a form of hirsutism. The hormones are all again going haywire.
I'm
Hello?
so sorry. My phone heated up, and this is what happened.
Yeah, so we are audible again.
Yes, yes, we are audible. I hope everyone can hear me.
Should we just wait till I think the others can join back?
Yes, let's just wait for a few minutes. So we were just talking about five commonly seen signs as soon as we reach the 30s. Let's just go through them again.
I can
So
recap them. Yeah. You just let
yeah,
me know. Yeah.
I think we can start with that.
All right.
Yeah.
So recapping the signs of what, the early signs of aging that we see when we turn 30: dull skin, fine lines and wrinkles, pigmentation, uh, a loss of volume in the face or sagging, and adult acne, hair, and a lot of facial hair, body hair, which suddenly comes up. There can be many other things which are troubling you in your 30s, like stretch marks because of weight gain, weight loss, or after pregnancy. There can be a lot of skin tags that come around your neck if you have
Right.
thyroid or if you have adult onset PCOD after your pregnancy. Or there could be a lot of other things. This is just to basically keeping all our patients in mind. We've just taken like an average of what symptoms they show and made a list of the top 5.
Right. Great. Should we go on to the next thing? How should we
Yes.
prevent the aging?
All right. So now see, there are a lot of things that we can do. Let's tackle one symptom at a time. Also, there are oral medications. I generally divide my treatments like this. We first take a detailed history of the patient because each patient is different. Just because you're 30, your skin and my skin, your body and my body,
Absolutely
your hair and my hair will not react in the
not.
same way. We may not face the same issues. Some of us
Right.
may be genetically blessed with good skin, some with good hair. So we would have those problems later than somebody else for whom that is a weak area. So
Right.
this is a individual thing. It's not, but what we are addressing is a more generalized thing which will
General.
cover more people. Yeah.
Right.
So, dull skin. Supposing you have dull skin, we now there are a few oral things we can do. There are a few topical things, and then there are treatments. So, one thing that I would suggest, like a skincare regime for everybody who turns 30. Please start using your sunscreens if you all are not yet using them. I know a lot of people in their 30s who have not used it.
Mm.
Some of us have been blessed with good skin genetically, thanks to our folks, but it's not going to last because the kind of exposure we have to our technology besides the sun is so much that we are constantly having radiations. And it's not just about the pigmentation. We feel we're putting sunscreen so we won't get tan, but there is UVA damage, there is UVB damage, as well as there is visible light damage. Earlier, we felt like the visible light is not harming our skin, but it is. And not only the pigmentation and the tanning, but the fine lines, the wrinkles, all are because of sun damage. Photo aging is a big thing. So start your sunscreen.
Yeah.
How to choose your sunscreen? You need to see that do you have an oily skin, do you have a dry skin, or a combination skin. If you have a dry skin, use a cream based one or something with a moisturizer in it so that you don't need to do too many things, because most of us are so busy, we are lazy, we are busy, and so we're like, just let's not do it. So
Yeah.
instead use something which will have like multiple actions, so that just with one thing we are covered for a broader base. There is an amazing sunscreen with a vitamin C and an aloe vera. Some of the companies are doing a 3-in-1. So that's your morning cream and you're sorted.
Which one would that be?
So Bioderma has a very good product. It's a little high
Okay.
end. If you don't want to go there, there is another product called Miss the Sun, which is a little less expensive, but it can, more people could perhaps use it. Also, moisturizing is extremely important because even
How?
for fine lines, wrinkles, if your skin is dehydrated and dry, you're going to get more lines and wrinkles. So you need to use a good moisturizer, even if your skin is oily. So if you feel that your skin is oily, so you don't need to moisturize, no. You just need a gel base, maybe an aloe vera based if aloe vera suits you. You need to change your moisturizers, but you cannot skip them totally post 30 because the skin needs hydration. I would also recommend an internal sunscreen because see, when we apply a sunscreen, we might miss patches. Sometimes we forget. Sometimes we are too lazy to reapply. So antioxidants work as internal sunscreens. Vitamin C tablets, beta carotene, vitamin A in some cases. These supplements will provide an internal sunscreen. So if someday you even forget to use your sunscreen, you're still sorted. You don't need to. Please don't forget your sunscreen. This is just in case.
How often should we moisturize the face?
So just once a day is fine if you have an oily skin. If you have a dry skin, you can do it twice a day or after you stop applying your sunscreen. So like you'll only put the sunscreen again and again till like 2. Then you won't be reapplying it even if you're in an office or outdoors. Then 2,
Right.
3 hours you could put your moisturizer.
Okay.
And
And
another
what?
thing I stress on is an active ingredient. Now the age has come at 30, after 30, when we need some active ingredient. So it's important to understand why is the face sagging? Why are the fine lines coming? There is a protein called collagen made up of lot of amino acids. Collagen synthesis, when it is more, we have plump, fresh, young looking skin. Suddenly after 30, the collagen destruction rate increases rapidly and the collagen production goes down. So basically we have depletion of collagen. Now this
Yeah.
will keep increasing every decade. So 30, then 40, then 50. So we need to start now. We need to start looking after our skin so that we can replenish the lost collagen. So now there are a lot of collagen powders available in the
Yeah.
market, collagen tablets. We have
There's this
fillers. Yeah.
Japanese collagen,
So the
which
powders are much better than the tablets. They absorb much faster. And it's not a bad idea to start maybe at least by 35. Vitamin C orally does wonders. It does wonders for your immunity as well. In this time
right.
of corona, it's a
Yeah.
absolute must add on. But even for your skin, it acts as an internal, as I said, as an antioxidant and a sunscreen. We also need to add a vitamin C to your as an active ingredient to your night regime. Vitamin
Okay.
C is a wonderful drug and it's just a vitamin. It's not a medicine. So it's very safe. You can even use it in pregnancy. You can use it postpartum feeding. So you can use a good vitamin C serum. You can use it every night as well. If you want, you can alternate it with hyaluronic acid. So hyaluronic acid is a sugar molecule which naturally occurs in your skin. And it actually gives the skin the internal hydration and glow. But after 30, unfortunately, that also starts depleting. So there are a
Right.
lot of ways to add hyaluronic. We have mesotherapies, which are needleless procedures in which we just open up micropores and we flush the hyaluronic in. These are the treatments we do.
Okay.
Besides
Wow.
that, it's this amazing new product, but somehow in our country we are a little scared of injectable. But Volite is an amazing product. It's just pure hyaluronic acid, which can have face to give you a natural glow. And this is very good for virgin skin, where no Botox, no filler, nothing has ever been done. This is a very good anti-aging tool, which is now a lot of people are going in for it. And the younger you are, the better, because it's a preventive more than a
Okay.
treatment. Besides
Yeah.
that, vitamin K, supposing you have dark circles, which also start appearing more at this age, because some of us are breastfeeding most of our late 20s, early 30s, 2, 3 kids. Even if you're bottle feeding, you have to wake up. It's mostly the mothers who are up and down, up and down. So the dark circles are very common. We are watching the television to unwind post the child sleeping. We are
Yeah.
on our phones the entire day, reading. So dark circles is very common. The eyes are not rested. Put teardrops, keep a bottle in your purse, methyl cellulose drops. Don't let your eyes get dry, because with also the eyes are changing along with the skin, as we are turning, as we are going into a next bracket now. So we don't want the eyes to get dry, because then not knowingly, unknowingly also at night we might scratch our eyes. And this causes the small capillaries below the eyes to break, the distended capillaries. The skin there is very thin, and all the clots will collect, and it will give a shadowy appearance around our eyes. And then we don't look
Eyes, yeah.
fresh. Even if we're not tired, we feel like we're looking tired all the time. So
Yeah.
vitamin K is good, helps to drive it out in outward motions. We circle it always when we're applying the cream, we put it outwards like this, and we pump and glide, pump and glide. Another thing I must tell you, please don't put at any time your finger in the bottle of any cream. You're transferring the bacteria into the cream. Even if you washed your hands, keep a
That's very
spatula, a small spoon, something to take out the cream onto your palm, and then use it just that one time.
okay. Yeah,
Removing
that's
your makeup
important.
is a very important part of the skincare regime. Especially we put a lot of kajal, liner. This kajal, it micro tattoos the pigment below around your eyes. So slowly, gradually over the long term, this causes dark spots which are very difficult to treat. And even pigmentation in the upper parts of the cheek. So you have to take out your makeup. However tired you are, if you're too tired to do a skincare regime twice a day, leave your morning but do your night.
Okay.
It's
We've
extremely
got a
important.
lot of questions, doctor.
Yeah,
So,
let's start.
since we all are in quarantine, should we still use sunscreen?
Yes, please, sunscreen has to be used at home or outside. Like I said, screen time. Some of us are even cooking for the first time in our lives. So even that exposure is as bad as the sun. The television, our computers, we're working from home, everything. LED lights in our house. We're saving the electricity bill, but we're damaging our skin. So we need
Absolutely.
this. If you're motivated enough, round the clock.
Okay. Should we take collagen tablets, and how often?
So as I said, I prefer the powder because the absorption is more. And yes, if you're past 30 and you're going to be consistent, you can take it. You can take it for 3 months. You can give a gap for a month or two. Again, you can take it for 3 months. It's just going to benefit you because collagen is what makes not only your skin, but it will help in your overall health.
Okay. So we should take it for 3 months, give it a break for a month or two, and
A
get
break.
back.
Yes, yes. We don't want our
And
body to become too dependent on anything. So whatever you're taking, any kind of medication, we always give a break.
okay, that's amazing. Which vitamin C should we take? By Winnie.
So I wouldn't want to mention a particular brand. Uh, I would prefer if anybody likes, they can do a private consult. I would check their skin and then recommend the best vitamin C. But I'll say this much, that vitamin C is very unstable when it's alone. So if you're just going to the chemist directly and going to take it over the counter, check for something where there's a vitamin C with a ferulic acid or a vitamin E.
Okay.
So a combination of a vitamin C with a vitamin E or a combination of a vitamin C with ferulic acid will be written on the ingredient list. These are good, they're stable, they work much better.
Okay, that's amazing. And which vitamin C serum is good? By Mansi Kothari.
Yeah, so that's what I said. There are a lot in the market. I
No,
don't
that's the tablet. So they're asking for a tablet and a serum.
So tablets, anything is fine. You need to choose whether you want a dispersible form. The NSE 1000 is good. We want 1000 mg to go in. If you don't
Right.
like it, you get a lot of tablets because I personally don't like the effervescent drink. So I take the tablets.
The
But
Celine
it's very
is fine.
safe for your kids. So if your children like the drink, you can even give them vitamin C at this. It will be very good for their immunity.
Okay. Which collagen powder? I think powder also, as you said, there are many available in the
There are
market. You
many, like
can
you
do
said, the
your
Japanese ones are good, but I won't mention any brand here. But
yeah,
they can always check with me. I would be happy to help them. If they send me a photograph, even on my page, I'll
photography.
guide them.
Absolutely. Thank you so much. And what about facials and cleanups? Should we
Yeah,
do
so
it?
that's what. Now, what we spoke about right now is we spoke about home care. What we will do if the products are available, if everything is available at home. Now, I'll tell you a little bit about what we can do at the clinic and also what you can do if you prefer home remedies. If you're more into just doing natural things. Vitamin C is very rich, high in citrus fruits. So you can have a lemon shot. You can just squeeze an entire lemon, put in maybe a pinch of salt, some honey, little water, and just drink it once a day. That's a good immunity if you don't want to take anything external. Also at night, if you don't want to use any of the products mentioned from the chemist, you can apply lime juice on your face one night. You can keep potatoes in the fridge, grate them, take out their juice, apply them. It's a great bleaching agent. It'll brighten your skin. You can do the same with cucumber juice. It helps in tightening. Please remember, not everything in your kitchen is good just because it's natural. Weed is natural too. So there was an argument at one point that that's good, but I wouldn't agree. So just don't pick up anything from your kitchen and use it. Uh, Consult a dermatologist. What you need to apply on your skin should be safe for your particular skin. Like besan, works very well for some people. They have
Yeah, and some get a rash with
some would get a rash. So it's very person specific. But these are just three things that I mentioned which can be used at night. For a pack, I'm reading some of the people are asking for a pack as well.
pack. Yeah, home pack.
Homemade. So avocados now are
Before we
really good.
continue, let's just
Sorry?
before we continue,
Yeah.
let's just tell everyone that we have a quiz after Dr. Shaista is done. So we want you to win the quiz, the answer. So please be careful and please listen to whatever Dr.
Yeah,
Shaista is
we try to keep it
saying.
easy because we want you all to come, we want to meet you all face to face, but try to pay attention so you know the answer.
Yeah, that.
Yeah. So
So
that's what.
face
So for a home
packs for
pack, one good option is we get avocados nowadays. So the really ripe ones, which we can't eat, we can smash an avocado. You can take some yogurt or milk, some honey, add a little turmeric, a little cinnamon, and just mix it nicely, apply it, keep it for 10-15 minutes, and wash it off. This all, because right now, if you're not going out to a clinic or something and you would like to do something at home, even just lime juice and honey, this is also a good thing if you don't want to go into too much of
home.
depth. Malai, turmeric, and almond powder. This works well. This is just scrub your face also and wash. I don't recommend physical scrubs at all, but chemical exfoliants are really good. Something with lactic acid, mandelic acid, glycolic acid. If you find such products, you could even use them 2-3 times a week. Another thing which we didn't mention today are retinols. Retinols is an anti-aging miracle. It's basically a derivative of vitamin A, not
Okay.
safe during pregnancy, not safe during breastfeeding, not safe if you're trying to have a baby or if you're not using protection and you're open to having a baby, don't use a retinol. But if you are safe and sure that there's no baby anywhere in the pipeline, nor you're feeding, retinol works wonders. It's a good time to start, maybe just twice a week for now, because it can dry out your skin if you are prone to dry skin. Twice a week, you can start with 1 hour, and you'll see it works remarkably because it helps in fine lines. It also helps in pigmentation, just what's starting out. So it's basically like an anti-aging miracle. Now coming to the treatments that we offer at the clinic. So there are some friends and some patients who say, doc, I took a facial when I got married and that's it, I've never done anything to my skin, and they're so proud.
That's
And I'm
good.
like, that's really good, but times are changing because you're no longer 25, and you're going to just turn older from here. So we need to now put in more effort, look after our skin a little more. So regular facials is going to go a long way. So generally we recommend it once a month. But if for some reason that's not possible, or they're too busy, they cannot do it monthly, once in 2 months at least, please go to a dermatologist. Do not go to the parlor because you're no longer 20. You can't just afford a relaxing facial. You need to see that the products that are being used on your face are completely hypoallergenic. Also, scrubs, physical scrubs is one of the reasons why you get pigmentation later on. Because when we rub our face with something which is rough and it causes friction, we are actually activating the melanocytes, which are the pigment forming cells. And we are going to cause rebound pigmentation in the long run.
Right.
Also, steam. We don't need to take steam. Now, when we do our facials at the clinic, we use cryotherapy, which is intense cooling to open up the pores. We don't use steam because, with steam, what happens? The pores open and they may not cells shrink in time for when the patient leaves, and then there's just more collection of dust and particles, and your face looks good post facial for a short time, but then there's more damage in the long run. So facials are a must now. Even peels, you know what happens with peels? The As I told you, the cell turnover rate is now slowed down, and all the dead cells and all the old cells are collected at the upper layer of the skin. It helps to take off all that. We exfoliate the top layer chemically, no physical exfoliation. So then what happens? Your new cells can come up. The light reflects in a nice way, and you can glow again. So these are the first two things. We have a lot of other treatments like derma rollers. Derma rollers are a bit painful, but if you have acne scars or you have an uneven texture, more than the tone, they work miraculously. And it's a cheaper alternative to microneedling with radio frequency, which also we do. That's with a laser. So that actually the small needles go into your skin. It's not painful at all. It's like acupuncture. So don't get scared with the term needles. You'll not feel it. You'll in fact get addicted to it. And it's so natural that it's actually healing your skin. It's not adding anything fake or anything like that. So derma rollers or derma stamps or microneedling with radio frequency is another great anti-aging option. Plain radio frequency is also amazing. So that has no needle, so it's painless. We just use heat to actually tighten. So it's, when you start seeing the nasolabials getting stronger, the jowling just about to appear, that's a good time to start. We have the luxury with that to go really close to the eyes. So even the fine lines which are just coming, below the eyes, where nothing works. Botox can be put only here. We can't put it here. So for this, RF is like a miracle.
That's
I would
amazing.
also like to put in a little word about Botox, because we've got so much fear in our minds of, Botox and fillers and all that. So I'd like to tell you that please don't look at people abroad and think that that's what it does. That's what it does because that's what they want. So if we go to Dubai, everyone wants to look like Kim Kardashian. It's not the doctor's fault or the products. They are asking for it, so the doctors are providing it. In India, we want a more natural look. Nobody wants anyone to know that they've done anything. So as doctors, we realize that we just want you to think that you had the best facial, or you have the best skincare products. So the doctors give a very natural look. It's just especially botulinum toxin. It's got a bad name, but it's a beautiful thing. So we start getting straight lines on our forehead or frown lines. Some of us who are used to doing this very often, just crow's feet here which keep getting deeper as we turn 30. Just a little amount of Botox, and that can not only go away for 6 months, we also not allowing the patient to make those movements for the next 6 months. So actually at the end of 6 months, the lines will be lesser because he has not constantly worked out that muscle. We have just relaxed that muscle.
Okay.
So please don't shut your head to
It's
it.
not.
It's also a good option.
Right. Yeah, so it's not as harmful as we think. The
It's not
mind block
harmful
is
at all.
removed.
Not as harmful as you think. It's not harmful at all, and it's temporary. So it's not even going like, it's just everybody wants it to last for 6 months, but in 4.5 it's gone. So if you don't like it, you're back to where you were.
Yeah. We need to basically remove the mind block.
Yeah, so it's a block and now it's become a
Yeah.
phobia and a taboo, but it shouldn't be, because it's as simple as an RF actually, as a radio frequency.
Okay. Best, what is a good skincare routine for dry skin? That's like a lot of questions, a lot of people
Yeah,
have asked.
so see again what happens, even people who've been having an oily skin earlier might start having a dry skin post 30 because of the hormonal changes, because of, as I said, the change in the cell turnover rate. The sugar molecule, hyaluronic acid, is now getting depleted. The skin is slowly going towards dehydration. So as I said, you need a good hyaluronic acid serum. You need to moisturize 2 or 3 times a day. Cut down on washing your face and use a cleanser. Now, you don't need to use something with a glycolic acid or some strong face wash. You never need your face to have lather on it. You just need it to be cleansed. You will feel clean, that's enough. Once is also enough. If you have very dry skin, you don't need to wash your face with a soap or a cleanser again. Just one time is fine. And don't use hot water, it dries out your skin even more. You can moisturize a couple of times. You use a sunscreen with a moisturizer combined in it. Also, Volite, as I said, is a good option for internal hydration. You can start your
Volite.
Volite. Yeah, Volite is something we can talk more about. They can even ping me. It's basically hyaluronic acid which we put inside the skin. Mesotherapy is a good option. So instead of medifacials, we can go in for a mesofacial, in which without any needles, without any pain, we just flush hyaluronic into your skin. So it looks more supple and dewy, rather than looking taut and dry all the time. The face mask that I mentioned at home, you can add 2 dollops of face cream to it if you have dry skin.
Okay. Yeah,
Any
that is.
face cream with vitamin E.
So also, many moms are very lazy to put cream, put moisturizer. So someone's asked a question: minimal skincare for lazy people. So like you said, get
Yeah,
a get a sunscreen and a moisturizer, two in one. So you're
3
done
in
with
1.
the plan.
Yeah. A
In one,
vitamin
yeah,
C also. So they are just sorted.
yeah, that's sorted. And if you can't do a night routine, if you can't do 2 times a day, at least do once a day in the night. You
Night.
can
Because your
skip
skin,
it.
your skin has gone. Now we're not going anywhere, but even if you step out, your skin has gone through a lot during the
Yeah,
day. So it needs
right.
more pampering at night. And when you wake up in the morning, you've just woken up.
Yeah.
So your
So,
skin is also rested for a bit. So,
and what about night care routine? So, like you said, someone's asked what
an
should we do
active
in the night?
ingredient, as I mentioned. So a hyaluronic, a vitamin C. We can add a retinol. So anything with a retinol twice a week. If they have any kind of pigmentation, we can combine it with any product which has an azelaic acid. So that will actually look into the fine lines, into the firming of the skin, anti-aging as well as pigmentation. It's a
Okay.
combination. It's always better to consult your dermat so that you're sure. But this is just in conversation that I'm telling you. Twice a week, an azelaic acid with a retinol, and rest of the week, a vitamin C with a vitamin E. And
Perfect.
you must moisturize after this.
Okay. And which brand of retinol? Prerna has a question. Which brand of retinol?
Yeah, so generally I don't like to,
Give
go
brand.
into
So that we can
into
do a.
brands, but it depends. Like something like an adapalene or an adapalene are very mild versions. If you go into the Retino A or something, then they are stronger. So of course, it all depends on what you need.
Okay. And
But I mentioned
obviously,
some of the top brands which are available locally at the chemist.
you need to see their skin type to uh, properly
Yeah, because
prescribe it.
supposing they have dry skin, but a
Yeah.
lot of pigmentation, and they use something as strong as a retinol. So, and then they get a lot of dryness. I
Right.
wouldn't want it to be because, I mentioned it and they just used it without further guidance. But supposing it's a completely normal skin, no dryness, very less pigmentation, twice a week, this regime works well for most patients.
Okay. And mommy station, how often do you need to use the retinol? It's twice a week. How effective
Twice
is
a week
three
for
hours?
normal skin, just as an anti-aging. And if it's suiting you, also start with an hour, because for some people there's a lot of dryness. So you start with an hour for a week. If it suits you, make it 2 hours and then keep it full night.
Okay. What about hair loss after
I'm
delivery?
sorry. Yeah, sorry.
Hair loss after delivery.
Yeah, so that's a whole topic on its own. We can do a live on that. It's such a big one, but I'll go briefly into it. So, postpartum hair loss is not a myth, it happens. We have patients, I mentioned in one of my talks that, the patients actually complain that they're losing hair like post cancer therapies. Just keeps on coming off, and they are so worried that they're going to go bald. So, please
Right.
don't worry, you're not going to go bald, and this is temporary. Your hair will come back, all of it will come back. But yes, of course, it might take 6 months, it might take a year. Basically, hair fall happens in cycles. So there is a growth phase, or an anagen phase, which is over in your pregnancy. That's why you've had amazing hair in your pregnancy. Then the fourth trimester, or just when your baby's out, the first 3 months, that time all your hair is in the resting phase. And then starts the disaster of the catagen or the hair fall, where you just start losing everything together. So that is also the time when you started stepping out of the house again. You want to look good. You've not lost your pregnancy weight. You still have some of the pigmentation. So you're low on confidence. So you don't want to lose your hair also at that time. And there's a thing we always say, that the baby starts laughing and the mother starts losing hair. So it's a myth, but it
Yeah.
matches the milestone. So the baby's social smile and giggle is the time when all your hair starts going. So what you can do is, we can do lots of home things for it. You can start a biotin 10 mg tablet. You should consult your dermatologist, but this is just advice till you manage to do that. We are available for teleconsults also to, specialize a treatment for you. But biotin helps, amla powder helps. There are protein powders available which you can have with milk or almond milk, which can also help you. Then there are more detailed specific treatments like minoxidil, which I will not be comfortable with without a consult. But we can do all this to reduce the hair fall, so that because you are going to get your hair back, but you don't want to lose most of it and then start getting it back. So we can
Right.
reduce the hair fall so that you just need to get a little bit back and you don't lose most of it.
Right.
A year maybe and you start getting it back. If after a year you're still not getting it back, there are some deficiencies. Check whether you were taking your B12, your D3, your iron. Are you anemic? Is your hemoglobin fine? You need to do a blood test then at that point to just check that are there deficiencies, why is the hair fall not stopping.
So basically, wait till a year, try having biotin and try having amla
It's not
powder.
necessary that you need to wait, but your hair fall is not going to completely go away till then. That's what I'm saying. You
And
can still
immediately it's
consult
not going
and
to stop.
reduce
Stop.
it. Sorry?
Im- Immediately it's not going to stop. So give it some time. Keep
No,
having
and
your.
if it doesn't stop in a year, then do consult your
Then you
dermatologist. You
need to
get your
continue.
test done. We can do treatments with hair peptides, give you more adjuncts. Because then it's not postpartum. Then it's because of your
Right.
deficiencies and other causes.
Yeah. Meera has a question. Any specific home remedies or scrubs for rosacea? And wanted to know if I can try any home remedies for it.
For what? I didn't get you. I can't hear.
For rosa.
Rosacea. Is it rosacea? Yeah. Okay. So rosacea, basically, for people who don't know about it, is a condition where the face starts flushing. So it's like blushing, and then you start flushing, and then what used to go on for a few minutes becomes permanent, and your cheeks become red and burning every time you go out in the sun or you have a hot shower, you eat anything spicy. Along with adult acne, adult rosacea is also a thing. Sometimes it comes up just in your pregnancy, and then it doesn't go away.
Right.
So what exactly is she asking me about rosacea?
She's asking for home remedies or scrubs to
So
try
no
for.
scrubs at all, please. No chemical scrubs, no physical scrubs to be used in any skin condition for Indian skin. Especially in rosacea, if you scrub your skin, it's going to get worse. So basically, you need to do things to cool yourself down, internally and externally. So you can add chia seeds, sabza, cucumber, cooling things to your diet. Avoid too much of garlic. Tea, don't have very hot tea. Don't have too many hot showers. Put a lot of sunscreen. That is the golden rule. If you're sweating, cooking, you're under the lights, you need sunscreen round the clock. Besides that, then there are medicines available, but for that I would have to consult her. I would not recommend too much of home remedies for a condition like rosacea because we don't want it to get to a stage where the redness is permanent.
Okay. I hope that we've answered your question, Meera. So this has been an amazing session. I think we should get on to. Is there anything else you'd like to say before we get on to the quiz? I'm super excited.
No, so I think I have more or less covered everything. If y'all have any other questions, y'all can get to me. What
I
I
think
can, yeah,
I have one question. A
yeah.
good face pack for a 15-year-old. Someone had messaged me.
Yes, a 15-year-old, the best thing to do is, you can take some fresh cream or malai. You can take some haldi, as I said, turmeric. You can put some amba haldi in it, which is also really good. It
Available.
brightens up the skin without any, external thing. And you can just take some almond powder because I don't like to use besan or bajra on skin. And you can apply it, keep it for some time, and just wash it off. So this is more than enough for the 15-year-old feels pampered as well and nothing too extreme.
I think that's been good. We have answered most of the questions. How to clean spots on face? Last question for today.
Yeah.
How to clean dark spots on the face? I don't know what that means.
So I think dark spots or pigmentation is one of the most resistant things that you get during your 30s. Please consult a dermatologist. It's going to get deeper. It's going to move in more, it's going to move from the upper layers of the skin, that is the epidermis, to the dermis. Once it
Okay.
becomes dermal pigmentation, it becomes tougher to treat it even with lasers. There are many simple things we can do for freckles, for melasma, for pigmentation. Like we can start with even basic peels and you'll see amazing results when you take maybe oral glutathione, you take vitamin C retinol creams, as well as go through peels. We have Q-switch lasers which work amazingly for freckles and even other pigmentation. So it's basically there's a multiple approach to this. We can't just do a single thing for pigmentation because it's resistant and it keeps moving deeper as we talk.
Right. So I think yes.
Somebody's
Thank you.
also, I think, asked about ice cubes, application of ice cubes on the face. So yes,
Okay.
there's no harm. It's not like it's basically what happens is when you apply any product or anything, it's again, and you apply something cold to it in the end, it just seals the product in. So a little bit of it, if you have the time, I'm sure the person asking is not in their 30s because we don't have any time to even freeze the ice cube. But if you do have the time, please go ahead. It's just pampering your skin and there's no harm.
Okay. Biba Fox, are we able to book a one-on-one skin consultation? Yes, you are. Dr. Shaista is available on WhatsApp and a video consultation. So you can get onto her ID, send her a message, and get that booked.
Yes, we have you can follow us at Elegance as well, and we will share my numbers after this if you'd like a
I will see.
teleconsult. I'm also opening up the clinic next week for just twice a week with all PPE, full sanitization, in case anyone has any procedures that they'd like to do. For the patients who are on monthly procedures, we'll be having only 5 patients a day, even though it's twice a week. So you can book your appointments in advance if you'd like to come in person. Otherwise, on teleconsult also, as long as I can see you and I can take your detailed history, I can really help you out in a much better way than a general thing, because general things work very well for people with normal skin. But if there is any deviation, then it always helps for a personalized approach.
Perfect. So yes, let's get going with the quiz. Guys, we're gonna ask 3 questions, and the person who answers first is gonna win a voucher. So are you all ready? I want some thumbs ups on the chat so then we can go ahead. Are you all ready for the quiz? I don't think anyone wants to. Yes, we're getting answers now. Super. Let's get going, Dr. Shaista. What's the first question?
Okay, so the first question is, I hope you all were paying attention because it was right at the beginning of the talk. What are the 5 signs of aging that you see at 30?
Yes, this was discussed by Dr. Shaista. This was the first thing we discussed.
The
Let's
5 signs of aging, you can just name them. Should I ask all the questions and then we can answer? Or?
no, let's go one by one.
All right.
Do you want all the 5 in one message? Fine lines, pigmentation. Yes, that's right, but there are 2 more.
And fine lines and wrinkles is just 1 point. So
Dark circles, hair loss, fine lines, dry skin, pigmentation. Yes, I think this one's the right one. Dark circles, hair loss, fine lines, dry skin, pigmentation. That has all covered.
So dark circles was not one of the 5. It was a little different, but if nobody else gets it, we'll give it to them.
So we have 2 more answers. Pigmentation, fine lines, loss of collagen, dark circle. No, dark circles is not the right one, guys. There's another one.
So when your skin is not bright, what is it? What does it appear?
Sagging.
Sagging is one. That is the sagging was the loss of collagen that they are mentioning. We can take that as sagging.
Fine lines, pigmentation, loss of collagen.
The 5th point also nobody's got, I think.
Dull skin.
Dull skin is right, yes. That's
Yeah.
the first point. So it's dull skin, fine lines, pigmentation, loss of collagen or sagging. And what is the last one? What do you generally get in your teenage? But sometimes you get it.
Acne.
Yes. I think Prisha has to win the quiz. But she's welcome anytime. She doesn't need to win the quiz.
I think we've got someone answered. We'll
Yes.
announce the winner at the end. Let's go with
Right.
question number
Okay.
2.
What is the sugar molecule which is naturally occurring in the skin, which keeps the skin supple and hydrated and keeps us looking young? A naturally occurring sugar molecule in the skin.
Guys, question number 2 is out. Are you all ready? Can you please repeat
Question
the
number 1, we've already found the winner.
winner?
So,
Yes.
yeah.
Question number 2. Please repeat the question, Dr. Shaista.
Yeah, but I think somebody's answered it already.
Okay.
But yeah. So it's the sugar molecule which naturally occurs in our skin. Unfortunately, after 30, the production of this decreases, and then we can either introduce it through mesotherapy, we have serums with it, or we have an injectable called as Volite, which will help you to look younger and feel more hydrated.
There, so we've got the answer. Hyaluronic.
Yeah. Hyaluronic acid is the naturally occurring sugar molecule present in the skin.
Perfect. Should we go with the last question now?
Yes. So this was supposed to be a question, but I didn't mention it in my talk. So I'll just quickly tell you about retinol. Please don't use retinol in the morning. Most of them are not photostable. Please, if you are using a retinol, especially based on our conversation today, without consulting a dermatologist, it has to be used only at night because it reacts differently to sun. So please do not use it in the day. Okay. So now the last question, should we keep it easy? Simple question?
Yeah, let's keep this one easy.
Okay. So the last question is that do we need to use a sunscreen when we are at home, or do we only need to use it if you're going out in the sun?
Yes.
Okay, so I'll just make it a little tougher. How much time does it take for a sunscreen to work? Can we put it and just leave, or do we need to give it some time?
Do we need to give it some time, guys? If, you need how much time?
Do we need to apply the sunscreen and wait, and then we can have an exposure, or can we just apply it and it starts working immediately?
So we're just getting 20 minutes. Nutrition by Monisha is answering all the questions. So
Yes,
it's
so
15
that's right.
minutes
20 minutes to half an
30.
hour. 20 minutes
30.
to half an hour. Half an hour is actually
The right one.
the right one to be on the safer side, but fine, 20 minutes also should do.
So here our winner is Akash. She has 30 minutes and that's the first answer. Wow.
I think somebody, Hema Jokhani, also said 30. Just check.
I think hers has come after.
Okay, perfect.
So we have Akansha 15 minutes. Oh, Prerna Khabrani has said 30 minutes. Sorry.
Perfect. So we made one question easy so that there can be lots of it.
The balanced form. Awesome. Thank you so much, Dr. Shaista, for being here. I hope you enjoyed it.
It's been such a pleasure. As I said, with you, it doesn't feel like a live. I feel I'm in conversation with you.
Yeah, same here.
So pleasant, yeah. And I've got attached to all your followers also. I feel like, I'm just doing a session with my own people. So it's been a great pleasure today.
Thank you. Thank you so much.
Anything else also, please, they can PM me at any time.
Thank you so much, guys. So Dr. Shaista is doing teleconsultations. Get in touch with her for any needs you have. I'm going to put in her phone number and her Insta page so you guys can follow her and check. She keeps putting up a lot of tips on skincare. So please do get in touch. And thank you so much for being here. I'm very happy to be here with you guys and I hope you had a good time. Thank you.
It's been a pleasure.
Same here. Bye-bye.
Bye. Bye.
Thank you so much, guys. I hope you all have had fun. I'm going to now announce the three winners. So the first question was answered correctly by Meera Kohli. So our three winners for today are Meera Kohli. I'm going to try to tag you all. Second question was answered by Nutrition by Monisha. And the third question was Prerna Khabrani. Thank you so much, guys. Please send me a DM to get your vouchers. And hope you had a good evening. Bye bye. Have a good weekend. Take care.